Hello, my name is Adam Riedel. This is my BSN 226 post-operative care VCBC instructional video or teaching exercise video. For this, I'm really just going to kind of need myself, a pretend bed, and my incentive spirometer that I'm going to be teaching with. I didn't know if I actually had to have a model to teach to. I didn't see a release form or anything like that, so I'm just going to demonstrate all of the teaching things like I would normally do to a person. I'm just going to kind of simulate that the camera is the patient in this regard, and so I'm demonstrating all of these skills to the patient being you. So I would ask who you are, your name and birthday and everything like that, make sure that I have the right person for the teaching that I'm going to do, and then go over a few things with them. The first thing would be talking about the importance of what's called diaphragmatic breathing, and what that is diaphragmatic breathing is big expansive breathing, and that's going to help promote gas exchange, help promote perfusion, and help prevent things from post-operative care such as pneumonia or what's called atelectases, and that's when your the alveoli, the little air sacs in your lungs, kind of get stuck together, and they don't work as well in that regard, so gas exchange gets compromised. So a lot of the times that can happen with shallow or labored breathing after anesthesia from pain or just being sleepy. So having people work on that diaphragmatic breathing afterwards is very important to help promote their breathing and get back to normality. And that would be in through your nose, out through your mouth. Big deep breaths, doing that after surgery. Something else that would help with that would be incentive spirometry. And what incentive spirometry is it essentially does the exact same thing as kind of diaphragmatic breathing. It will help promote lung expansion. Typically a healthy human adult will have, we can take about 6 liters in our lungs, so probably more or less 3 liters per each lung. A patient that has COPD might not do as well with a incentive spirometer, but the way that you can determine how high up the person is supposed to go with the gauge is normally in the incentive spirometers it comes with a little sheet, and it comes with a little chart that will have ages and heights in there. So we will take me for example. So I'm at 72 inches and 30 years old. And so I would be at 3,500, which is, this only goes to 2,500, so we're just going to be at the top for a little bit in that regard. The important thing to talk to people about with these is to not blow into them. You're supposed to breathe into them. You're supposed to blow out all your air before, and then you don't just like push it really hard into it. You have to make sure that you're in between this line. This little yellow square will dance while you're using the incentive spirometer, and you have to kind of keep it in this controlled area, and that's the point of using this, is just keeping it in a nice controlled breath. So I'll demonstrate how to do this now, and like I said before, you're going to have to breathe out first and then slowly exhale in, and then like I said, this is just going to really help promote lung expansion. So as you can see, I got it up to the top and kept it up there for a while. The top is 2,500, and doing this 2 to 3 times every hour is going to really help with patients and their SpO2 and their breathing. So also we're going to want to talk to them about certain breathing techniques. The huff technique is a really good one, and then I'm having trouble figuring out remembering what it's called, but where you go forward. And you would cough into yourself while kind of splinting. So the first one is where you would turn your head up and kind of inhale all half, like 3/4 of the way, and then when you exhale, you forcibly exhale up. And when your neck is kind of in that position, it's going to give it a good kind of forward motion to sort of be able to get the phlegm out of there and really kind of just clear your airway really well. That would be what the huff technique would be more appropriate for. The other one, which would help with pain control with breathing and coughing as well, would be splinting your abdomen, breathing in through your nose, And when you exhale, you bend forward and you would cough a couple of times, open mouth. So, and why I do that is when I'm pushing on my stomach that way, I'm splinting my abdomen, making it a little bit easier for me and a little less painful for me if I have to cough, if I've had abdominal surgery or anything in that regard. Another thing to watch out for is turning a patient after surgery. Sometimes the patient might be in a lot of pain or are very sleepy, and they might not A, want to turn themselves, or B, have the ability to turn themselves. So we need to make sure that we're turning people that aren't able to do that themselves to help prevent bed sores from arising. Stroke and dying patients, we should always make sure that we're turning them at least Q2 hours, minimum Q2 hours. Every other one should be at least every 4 hours, ideally. When you're turning a patient, typically you'll have what's called a draw sheet underneath, and a lot of the times you could take the draw sheet and help pull them, and then another person can use their arms and put a hand at hip and shoulder, and then they can prop them on a side, putting pillows on either side of them to prop them on one side or the other, alleviating one side of the body from pressure points if necessary, or propping pillows underneath, or propping a pillow under the heels can help eliminate those bony prominences from having pressure for extended periods of time. Another thing that we would want to talk to patients about post-operatively that's very, very important would be the prevention of deep vein thrombi or DVTs, and how we would kind of instruct a patient how to prevent that from happening without scaring them, because the DVT is quite dangerous, but without scaring them, and how to make it as layman as possible would just be to talk about simple exercises for their legs while they're laying in bed. So we would want to sit them on the side of the bed, or have them in supine position, and so in this case I'm just going to be kind of sitting on the edge of the bed, pretending that I'm the patient, and what they would want to do would be leg exercises, bringing the knee up, having it hold up for a couple seconds, bringing that leg down, up, down, and the same with the other one. And you could do this laying, in the bed as well, but just raising that knee, keeping it up for a while. That's going to help with blood flow and circulation, help with muscle movement. The same thing would happen with their legs if you need to go up with just their feet. I have my shoes on, but if the patient had no shoes on and they were in bed, we would talk about doing that with their toes, bringing their toes in, toes out. And it's the same basic concept all throughout the entirety of it. You're just helping promote circulation, venous movement and things like that. We would want to also do rotating their legs like so. Resistance things could help too. And this would be good for assessing as well while you're doing these kind of range of motion exercises with the patient. Getting one leg into the bed, kind of getting it out. One leg into the bed, getting it out. And really all of these are to help promote recovery and help promote the absence of deep vein thrombi, which can become very deadly, which can turn into what's called a PE, or pulmonary embolism, which if unchecked can be very, very life-threatening, very, very fast. I would make sure that my patient had their call light available, and if I was showing a patient all of these techniques, I would want to demonstrate to them, which I did, and then have them teach it back to me in order to determine the aptitude of how well they were able to understand what I taught them. And then from there, whatever that result would be, I would document that teaching and how they understood that teaching as well. Thank you very much.